Gladys is a 76-year-old female who had a stroke 10 weeks ago. She's evaluated by a physical therapist for a stroke, and the physical therapist creates a plan of care. Question for Adam Diamond. What is required of the plan of care? The physical therapy plan of care requires the PCP to certify within 30 days, but the patient has not recently visited his PCP in the past 10 years. Question, Tyler Perkins. What choice does the PCP have? The PCP refuses to sign the plan of care since they've not seen the provider, requiring the patient to come in for a visit. The doctor agrees with the patient plan of care and signs off on the PT's note.
Thank you.
Gladys returns to physical therapy for treatment and begins outpatient physical therapy and outpatient speech therapy for rehab of both her physical and speech deficits secondary to the stroke. Billy, what modifier needs to be documented by the PT due to the complex nature of the condition and expectations to reach the therapy cap? Gladys reaches the $1,960 therapy cap. Patient still requires skilled physical therapy due to strength impairments, balance deficits, gait impairments, and decreased endurance. Shannon Chapman, what can the PT do to continue with Gladys' plan of care? Patient is at home one day, slips on a banana, and falls onto her head.
Got my life alert! All senior citizens should have life alert.
The ambulance comes and brings Gladys to the hospital. In the ER, Gladys is referred to imaging. The imaging shows that Gladys' hip is broken. Gladys spends her time in acute care until she is discharged to the skilled nursing facility to rehab in order to return home. Sarah Buffer, would the services provided in the SNF contribute to the therapy cap? The patient is discharged from the skilled nursing facility and returns home with home health services. Then she is discharged from home health services and returns to outpatient therapy. She reaches the therapy cap threshold, and the rest of the services must be paid out of pocket. Dr. Apke, what kind of documentation should be signed by the patient showing their agreement to be financially responsible for therapy services?